Thank you. Go ahead.
You
Caitlin.
had a call with Senator Schumer. He says you've now agreed to invoke the Defense Production Act to actually make those medical supplies that hospitals say are in severe shortage. So 2 questions. Is that what you're doing now?
It is. I did it yesterday. We invoked it, I think, the day before. We signed it the evening of the day before and invoked it yesterday. We have a lot of people working very hard to do ventilators and various other things, yes.
So you're using it now to tell businesses
We are
they need to
using
make
it.
ventilators, masks, respirators?
For certain things that we need,
Okay.
including some of the very important emergency. I would say ventilators, probably more masks to a large extent. We have millions of masks which are coming and which will be distributed to the states. The states are having a hard time getting them, so we're using the Act. The Act is very good for things like this. We have millions of masks that we've ordered. They will be here soon. We're having them shipped directly to states.
So you said you were signing this but not invoking it. This is what you said yesterday, and that you would only do so in a worst case scenario.
Yeah.
So are we now at a worst case scenario?
We need, no, it's no different other than we need certain equipment that the states are unable to get by themselves. So we're invoking it to use the powers of the federal government to help the states get things that they need, like the masks, like the ventilators. Yes, Steve?
What Governor Cuomo has done in New York, is there any more consideration to a national lockdown to keep people in their homes?
I don't think so. Essentially, you've done that in California. You've done that in New York. Those are really 2 hotbeds. Those are probably the 2 hottest of them all in terms of hotspots. I don't think so, because you go out to the Midwest, you go out to other locations, and they're watching it on television, but they don't have the same problems. They don't have, by any means, the same problem. New York, California, Miami, the governor's doing an excellent job. Governor DeSantis in Florida. We have some pretty hot spots in Florida, too. But we're and the state of Washington, of course. But that was largely, if you look at it, it was 1 nursing home that had problems like you wouldn't believe. So no, we're working with the governors, and I don't think we'll ever find that necessary.
We're about a week into your 15-day guidelines. Are you happy with the progress? Would you like to see?
I am happy. I am happy with it. We'll have to see what the results are at the end of 14 days. Let's say we'll know by the 15th day to see what we do. But I'm certainly honored by the way the American people are working, because it's work. It's work not to work. This is the first time this has ever happened. And we're working out a tremendous financial package for them so they don't work. Who ever heard of this? Usually you work out a financial package to get people working. We're asking people not to work. Social distancing, a new term that's become probably the hottest term there is. So, no, I'm very honored by the way the American people are taking this, I mean, so seriously. Yes, John?
Mr. President, a question for you and a question for Dr. Fauci, if I could. There's been some concern among Democrats on Capitol Hill that the Phase 3 fiscal stimulus is weighted too much in favor of corporations and not enough in terms of individuals. What did your conversations with Senator Schumer yield on that front?
Well, I think that really all of that is being discussed right now. We talked about, as an example, buybacks, stock buybacks. I don't want to have stock buybacks. I don't want people spending. I don't want some executive saying we're going to buy 200,000 shares of stock. I want that money to be used for the workers and also for the company, to keep the company going, but not for buybacks. I would, I mean, I haven't spoken to a lot of the Republicans or Democrats on it. We discussed it, and I don't like buybacks. I didn't like them the first time.
Are you and Senator Schumer?
So we're
discussing.
We're discussing that. We're discussing many things.
Are you on the same page with Senator Schumer?
We're not so far away. I'll tell you, we're not very far away.
And to Dr. Fauci, if I could, Dr. Fauci, as was explained yesterday, there has been some promise with hydroxychloroquine, this potential therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no, and the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that would give us information to determine if it's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it.
President, on that. On those therapies.
I think I'm without seeing too much, I'm probably more of a fan of that than maybe than anybody. But I'm a big fan, and we'll see what happens. And we all understand what the doctor said is 100% correct. It's early, but I've seen things that are impressive, and we'll see. We're going to know soon. We're going to know soon, including safety. But, when you get that safety, this has been prescribed for many years for people to combat malaria, which was a big problem, and it's very effective. It's a strong drug. So we'll see.
Fairly effective against SARS.
It was as I understand that. Is that a correct statement? It was fairly effective on SARS.
John, you've got to be careful when you say fairly effective. It was never done in a clinical trial. They compared it to anything. It was given to individuals and felt that maybe it worked. So
Was there anything to compare it to?
well, that's the point. Whenever you do a clinical trial, you do standard of care versus standard of care plus the agent you're evaluating. That's the reason why we showed back in Ebola why particular interventions worked.
Sir, on that topic.
Mr. President.
About the possible therapies, yesterday, Mr. President, you said that they were for, quote, immediate delivery, immediate. We heard
No,
from
we're
Dr.
ordering. Yes, we have millions of units ordered. Bayer is one of the companies, as you know, big company, very big, very great company. Millions of units are ordered, and we're going to see what happens. We're going to be talking to the governors about it, and the FDA is working on it right now. The advantage is that it has been prescribed for a totally different problem, but it has been prescribed for many years, and everybody knows the levels of the negatives and the positives. But I will say that I am a man that comes from a very positive school when it comes to, in particular, one of these drugs, and we'll see how it works out, Peter. I'm not saying it will, but I think that people may be surprised. By the way, that would be a game changer. But we're going to know very soon. But we have ordered millions of units. It's being ordered from Bayer, and there is a couple of companies also that do it.
For clarity, Dr. Fauci said there is no magic drug for coronavirus right now, which you would agree. I guess on this issue,
I think we only disagree a little bit.
Sorry.
I disagree. Maybe and maybe not. Maybe there is, maybe there isn't. We have to see. We're going to know.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
Misrepresenting the preparedness right now.
No, I don't think so. I think that I think it's got
the not yet approved drug.
Such a lovely question. Look, it may work and it may not work. And I agree with the doctor what he said. May work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it. And we're going to see. You're going to see soon enough. And we have certainly some very big samples of people. If you look at the people, you have a lot of people that are in big trouble. And this is not a drug that obviously, I think I can speak from a lot of experience because it's been out there for over 20 years. So it's not a drug that you have a huge amount of danger with. It's not like a brand new drug that's been just created that may have an unbelievable monumental effect, like kill you. We're going to know very soon. And I can tell you, the FDA is working very hard to get it out. Right now, in terms of malaria, if you want it, you can have a prescription. You get a prescription. And by the way, and it's very effective. It works. I have a feeling you may, and I'm not being overly optimistic or pessimistic. I sure as hell think we ought to give it a try. I mean, there's been some interesting things happened and some good, very good things. Let's see what happens. We have nothing to lose. You know the expression? What the hell do you have to lose? Okay?
So what do you say to Americans? Sir, nearly 200. I'll just follow up. Nearly
John, go
200
ahead.
dead. What do you say the Americans were scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
I say that you're a terrible reporter. That's what I say. Go ahead.
I
I think it's a very nasty question, and I think it's a very bad signal that you're putting out to the American people. The American people are looking for answers, and they're looking for hope. And you're doing sensationalism, and the same with NBC and Comcast. I don't call it Comcast. I call it Concast. Let me just for whom you work. Let me just tell you something. That's really bad reporting. And you ought to get back to reporting instead of sensationalism. Let's see if it works. It might and it might not. I happen to feel good about it, but who knows? I've been right a lot. Let's see what happens, John.
Can I get back to the science and the logistics
You ought to
here?
be ashamed of yourself.
The units that were ordered, are they for clinical trials or are they for distribution to the general patient population?
We are going to, as I understand it, we are going to be taking samples in New York. Governor Cuomo very much is interested in this drug, and they are going to work on it also after they get a certain approval. We're waiting for one final approval from the FDA. We'll see what happens. But we'll use it on people that are not doing great, or even at the beginning of not feeling
Sort
well.
of fall under the.
And John, what do we have to
modified
lose?
auspices. So this would sort of.
Wait, John, it's been out there for so long. We hear good things. Let's see. Maybe it works and maybe it doesn't.
I understand all that. I'm just thinking the application here. So that would be under sort of a modified compassionate access?
We're doing that, I guess, and that's what it's called, yeah. Yes.
I would like Dr. Fauci, if you don't mind, to follow up on what the president is saying. Should Americans have hope in this drug right now? And sir, I would like to follow up on Peter's question here. Could you please address Americans in this country who are scared right now? This is a very valid concern that people have.
No, there really isn't that much of a difference in many respects with what we're saying. The president feels optimistic about something, his feeling about it. What I'm saying is that it might be effective. I'm not saying that it isn't. It might be effective, but as a scientist, as we're getting it out there, we need to do it in a way as while we are making it available for people who might want the hope that it might work, you're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
Is there any reason to believe it's not safe?
Well, certainly as a drug, any drug, John, has some toxicities. The decades of experience that we have with this drug indicate that the toxicities are rare and they are, in many respects, reversible. What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe. But I like to prove things first. So it really is a question of not a lot of difference. It's the hope that it will work versus proving that it will work. So I don't see big differences here.
I agree.
Sir, your message to Americans who
agree.
are working at home, who have their children in their homes right now, who
Here
are
we go. Go
homeschooling,
ahead.
doctors who say they don't have the masks they need to do their jobs, your message to them.
My message to the American people is that there is a very low incidence of death. You understand that. And we're going to come through this stronger than ever before. If you get it, if you happen to get it, it is highly unlikely. It's looking like it's getting to a number that's much smaller than people originally thought in terms of the ultimate problem, which would be death. My message to the American people is, number one, you've done an incredible job. Incredible what you've gone through. It's been incredible. It wasn't their fault. It wasn't their fault. It wasn't the fault of 140 other countries where this has happened. And there is tremendous hope. And I think we're going to come out stronger, better, bigger in every way. I think we're going to be a better country than we were before. And we learned a lot. We learned on reliance, who to rely on, who not to rely on. But our country has been incredible, the way they pulled together, including the fact that I just spoke to Senator Schumer. We had a wonderful conversation. We both want to get to a good solution. But it's been really, for me, watching and seeing people that weren't speaking, getting along well, because we all have one common aim, and that's to get rid of this invisible enemy, get rid of it fast, and then go back to the kind of economy that we had, and maybe even better. Yeah, please, in the back. No, in the back, please.
Mr. President, I have two questions, if you'll indulge me. The first question is, many small businesses are concerned that they have weeks, not months, and are worried about how long it'll take.
We're going to be helping them a lot. We're going to be focused, a big focus, and including my conversation with both Mitch and with Chuck, a big focus of that conversation with small businesses, because they are really the engine behind our country, more so than the big ones. They are the engine behind our country.
Second, if I may, sir, are you concerned about members of Congress that may have used information they learned on updates to sell stocks and profit off of this?
I'm not aware of it. I saw some names. I know all of them. I know everyone mentioned Dianne Feinstein, I guess, and a couple of others. I don't know too much about what it's about, but I find them to all be very honorable people. That's all I know. And they said they did nothing wrong. I find them, the whole group, very honorable people. Yeah, please.
Mr. President, so the whole group would include Richard Burr, the head of the Intelligence Committee, and it also would include Senator Kelly Loeffler. And so the question is whether or not they should be investigated for that behavior.
Well, it also includes Dianne Feinstein, a Democrat. You didn't mention her name. Why didn't you mention her name? And I think she's a very honorable person, by the way. So I'm not saying, but you know, it's interesting that you mentioned two people, but you don't mention one that happens to be a Democrat.
Any senator, should they be
I don't know, because I'd
investigated
have
for
to
this
look
behavior?
at it, possibly, but I find them to be honorable people, yeah.
You said the other day you see yourself as a wartime president right now, leading the country through this pandemic that we're experiencing. Do you really think, going off on Peter, going off on a network is appropriate when the country is going through something like this?
I do, because I think Peter is, I've dealt with Peter for a long time. And I think Peter is not a good journalist when it comes to fairness.
But he's asking for your message to the country.
Oh, I think
You
it's a
went
good
off on
message,
Peter.
because I think that the country has to understand that there is indeed, whether we like it or not, and some of the people in this room won't like it, there's a lot of really great news and great journalism, and there's a lot of fake news out there. And I hear it all, and I see it all, and I understand it all because I'm in the midst of it. So when somebody writes a story or does a story on television, and I know it's false, I know it's fake, and when they say they have 15 sources have said, and I know there's no sources, they're just making it up. I know that, and I call Peter out, but I call other people out too. And this is time to come together, but coming together is much harder when we have dishonest journalists. It's a very important profession that you're in. It's a profession that I think is incredible. I cherish it. But when people are dishonest, they truly do hurt our country. Yeah, in the back. Please, go ahead.
Mr. President, China has been in communication with the United States and also WHO about coronavirus
Right,
in
that's true.
January.
That's
and
true.
the U.S. shut its border to travelers from China on February the 2nd. Also, Wuhan has been in lockdown since January the 24th. And this all happened almost 2 months ago. Why did you still say if you could have known it earlier? And also, you have been calling coronavirus.
Well, I have to say this. We have, and I can speak for myself, but I have a very good relationship with China and with President Xi. I have great respect for President Xi. I consider him to be a friend of mine. It's unfortunate that this got out of control. It came from China. It got out of control. Some people are upset. I know President Xi. He loves China. He respects the United States. And I have to say, I respect China greatly, and I respect President Xi. Okay.
Calling coronavirus.
Can I ask more about stock buybacks? Many of the airlines and Boeing did stock buybacks. Is this a deal breaker for you in this?
No, but I never liked stock buybacks from their standpoint. When we did a big tax cut, and when they took the money and did buybacks, that's not building a hangar, that's not buying aircraft, that's not doing the kind of things that I want them to do. And we're now talking about buybacks. We didn't think we would have had to restrict it because we thought they would have known better. But they didn't know better. In some cases, not in all cases, obviously. Some people did an incredible job. They built plants all over the country. I mean, you'd see what's happened. I mean, we were doing, until this invisible enemy appeared, we never had an economy like this. But there were some companies that used that money to buy back stock, driving up the price of the stock artificially in many cases. I don't like that. I don't like it. And as far as whether or not we'll have that, allow them, when we give them money, because we have to keep these great companies in business because of the workers, frankly, for the most part, because of the workers. The workers are my #1 concern. But the way we take care of the workers is we have to keep the companies going. I am fine with restricting buybacks. In fact, I would demand that there be no stock buybacks. I don't want them taking hundreds of millions of dollars and buying back their stock, because that does nothing. Yeah, please.
Thank you very much. One for Dr. Fauci, and then hopefully one for you.
Sure. And one thing, Secretary of State Pompeo is extremely busy, so if you have any question for him right now, could you do that? Because you know what I'd like to do? I'd like him to go back to the State Department, or as they call it, the Deep State Department, if you don't mind. I'd like to have him go back and do his job. So does anybody have any question? Please.
Mr. Secretary, can I ask you?
Go ahead, you want to call somebody?
Yeah, how about you? Only for the
The
secretary.
exemptions on work travel, can you define that? Is all work, anyone with a work visa can still cross the border? Can you define what, like, the measures that you're taking?
It's a great question. We're working, we're very real concerned about H-2A visas, in particular agricultural workers need to get across. We're going to make sure that we do everything we can to keep that part of our economic lifeblood working between our two countries. DHS and the State Department will work together. We want to make sure and keep commerce between Canada, the United States, and Mexico alive, functional, and prepared for the day that this economy bounces back like we expect that it will. Right back there. And then
Mr. Secretary, the Mexican government has not announced any travel ban on Europe. Where have you been in touch with them as to when they're going to do this and what it is that they're telling you? And then a second question, they also are telling us and said in a press conference this morning that they will not take back any non-Mexican citizen. Any other third parties will have to, we don't know what will happen to them. So can you address what will happen to those third country immigrants that you are saying that will not be allowed to enter the U.S. and Mexico is saying that they will not be allowed to stay in Mexico either or sent back from the U.S.?
if I may, I'll take the first one and then Chad, I'll give you the second one. With respect to travel into Mexico from outside, I spoke with Foreign Minister Ebrard a couple of times about this. I'm very confident we're going to get to a really good place that protects the Mexican people and the American people from those who might be traveling into places where we've got designations, the Schengen zone from China, so that they're not coming into Mexico and then coming into the United States. I'm very confident we'll do that, and we'll make that announcement shortly, together.
And again, as we implement the CDC's order, again, we're going to take a number of individuals that cross the border illegally and repatriate them or remove them quickly back to Mexico, back to the Northern Triangle, and back to any other country. So we're going to do that in a rapid fashion. We'll continue to work with Mexico to make sure that Mexican nationals go back as well as other populations.
But are you sending Guatemalans back to Guatemala or Cubans back to Cuba? What would you do with those third countries that are not Mexicans?
So we're doing all of the above. We're going to be sending, again, individuals back to Mexico, individuals back to the Northern Triangle countries, Cuba, Haiti, all of the, again, 122 different nations that we see nationalities that come across that border. We'll be sending them back individually to their countries, but also working with Mexico to send additional populations back there as well.
And just to put it, when you said, before you said the non-Mexicans going to Mexico, we're not sending them to Mexico. We're sending them back to their own countries, not to Mexico. Why would Mexico take people that aren't from Mexico? We're sending them back, in the case of Guatemala, Honduras, El Salvador, a lot of other countries, they go back to the country from where they came. Okay, and Mike, please.
Secretary Pompeo, on the issue of disinformation, is there any particular locus for this disinformation, or is it diffused?
It's pretty diffused, unfortunately, but we've certainly seen it come from places like China and Russia and Iran, where there are coordinated efforts to disparage what America is doing in an activity to do all the things that President Trump has set in motion here.
Other than what you're doing this morning, what are you doing to fight back?
Lots of things, lots of work. One of the things we want to make sure is the American people go to trusted sources for that information. But we've made clear, we've spoken to these countries directly that that they need to knock it off, that we don't approve of it. And then there are a handful of other things we're engaged in to make sure that the right information is out there and accurate information is given. This idea of transparency and accurate information is very important. It's how we protect American people from something like this ever happening again.
Mr. Secretary, the Peace Corps volunteers.
You want the American people to be coming to trusted sources of information. Does it undermine you at all when the president stands up here and he attacks news outlets calling us untrustworthy?
Somebody else have a question?
The Peace Corps volunteers have the Peace Corps volunteers.
Secretary.
Please.
In terms of Americans who find themselves stranded in places where there are no longer flights to get back to the United States, what efforts are being made to help them?
I appreciate that question. So we're doing lots of things. We've had a couple places in particular, Peru and Morocco. I think we've had the first 2, maybe 3 now flights out of Morocco. We're going to work to get people back. We're urging individuals when they can get back on their own. They traveled there on their own. When they can get back there on their own, they ought to try to do that. But we have a team stood up at the State Department, the Repatriation Taskforce, that is working each of these instances. So we've heard from individuals, members of Congress. We're trying to get Americans back from these places where air travel has been disrupted. And we'll get that done over time. We'll get it done successfully.
Do you have any sense of how big that problem is?
How long
is there any sense of just how big that problem is? How many people?
We don't know the full scale of it yet, but we think we have the largest number identified, and we're working. If there are those who are watching that are someplace, and you can go on the State Department website, you can log into, I think it's step.gov, and go step and log in, and we'll track it, and we'll try to get everybody back just as best we can.
Secretary, how long are these border restrictions likely to last along the south and north borders?
Well, they'll last as long as we need to do it to protect the American people from the virus. I couldn't tell you how long it's going to last.
Have you determined whether Iran is responsible for that rocket attack last week?
So
maybe we shouldn't say that.
So let me just get back to you on the answer to that. And what we can what we can say with certainty is this: we've made clear all along that the Iraqi Shia militias are funded, trained, equipped by the Iranians. And we've urged the Iranians not to do that, and we've told the Iranians that they will be held responsible for those attacks when they threaten American lives.
Secretary
The Peace Corps volunteers, the Peace Corps volunteers that are in 60+ countries, have they all been returned?
You know, I don't know if they're all back or not yet. I know that they were directed to come back. I know that most of them are back. I couldn't tell you if we have all of them back yet.
And then Secretary Esper's not here, but to get tests to the troops in Iraq and Afghanistan, are you able to give us a progress report on the status of that, if they're all able to get tests?
I don't know the answer to that. I know we have State Department officials, too, who are concerned, want to make sure we get them tests, our team as well, and we're working on that. We've had significant success on that to date. There are a few places we've not been able to get them, but we will. We'll get them there.
Secretary Pompeo, how exactly are you going to get those Americans back, and do you have any plans to get the military involved in that?
We're going to use all the tools we can. These first efforts are combined commercial, private flights that will fly in, bring them back to a destination here in the United States. So we'll do that. There are some that will travel back other ways as well. And we've worked with the Department of Defense to say where there is space available, we'll be able to bring them back on those flights as well. It's a whole government effort to make sure we get them back. They're gonna help us every place they can. Secretary Nesbitt, I've talked about it a couple times.
Thank you, Secretary. Question on Iran again. Is there any consideration to relaxing sanctions on Iran during the coronavirus crisis, since they've been particularly hard hit?
That's an important question. The whole world should know that humanitarian assistance into Iran is wide open. It's not sanctioned. We've offered to provide assistance to the Iranians as well. I talked with Dr. Tedros from the World Health Organization about this. We're doing everything we can to facilitate both the humanitarian assistance moving in and to make sure that financial transactions connected to that can take place as well. There is no sanction on medicines going to Iran. There's no sanctions on humanitarian assistance going into that country. They've got a terrible problem there, and we want that humanitarian medical healthcare assistance to get to the people of Iran.
But the sanctions themselves, no movement.
We are working to do all the things we've had in place for the first 3 years here to deliver security for the American people.
They know the answer. Iran, they know the answer. Iran, the leaders, they know the answer to your question.
Was it appropriate for the president to call your department the Deep State Department at a time when thousands of diplomats are working very hard around the world to combat this pandemic?
Worked with the president for 3 years now. I know how much he values the people that work on my team. I know when I was the director of the Central Intelligence Agency how much he valued the work we did. I know that he watches our team, Dr. Birx, all the team that's working to push back against this virus to keep America safe. I know how much he values them.
What a good answer. Yes, go ahead.
Mr. President,
can I ask a question?
Mr. President,
Very true, too. Go ahead.
Mr. President,
No, behind you.
I apologize.
Please, go ahead.
the news, I have two questions. The first is to Secretary Pompeo. The news hours learned that the CDC picked up that there was some sort of virus happening in Wuhan, the coronavirus happening in Wuhan as early as December. When did the CDC start letting other agencies know that there was something in China happening, that this coronavirus was happening? And then when did the whole government approach start to happen?
So I'll let the CDC or Dr. Fauci, you want to talk to that? Yeah, Secretary Azar, please. Yeah.
Yeah, so we were alerted by some discussions that Dr. Redfield, the director of the CDC, had with Chinese colleagues on January 3rd. It's since been known that there may have been cases in December, not that we were alerted in December.
And then, Mr. President, the other question I have for you.
Excuse me, we'll do it in a second. Let Mike has to go
May I just
back.
say one more thing? There's been some discussion about China and what they knew and when they knew it. And I've been very critical. We need to know immediately. The world is entitled to know. The Chinese government was the first to know of this risk to the world. And that puts a special obligation to make sure that the data gets to our scientists, our professionals. This is not about retribution. This matters going forward. We're in a live exercise here to get this right. We need to make sure that even today, the data sets that are available to every country, including data sets that are available to the Chinese Communist Party, are made available to the whole world. It's an imperative to keep people safe. We talk about the absence of data sets, not being able to make judgments about what to do. This is absolutely critical. This transparency, this real-time information sharing isn't about political games or retribution. It's about keeping people safe. And so when you see a delay in information flowing from the Chinese Communist Party to the technical people who we wanted to get into China immediately to assist in this, every moment of delay connected to being able to identify this the risk vectors, creates risk to the people all around the world. And so this is why it's not about blaming someone for this. This is about moving forward to make sure that we continue to have the information we need to do our jobs.
Mr. Secretary, what message do you think it sends to other countries when you have the President of the United States lashing out at reporters?
I've had my frustration with reporters too. All I ask when I talk to the media is that you listen to what we say and report it accurately, and it's frustrating. It's frustrating when you see that doesn't happen. It's enormously frustrating. We have a responsibility to tell the American people the truth, and those who are reporting on what it is we're doing and saying have an equal responsibility to report accurately.
What message does it send to countries when you're lashing out at reporters?
Not being reported, that the news media.
I've seen many things at the State Department be reported wildly inaccurately on multiple occasions, and I have spoken to those reporters about it each and every time, and I will continue to do so.
Mr. President, Senator Johnson has suggested...
Well, I'd rather have, if you could finish up with the Secretary of State.
I think I've worn him out, Mr. President.
Well, let me
Is
ask
everybody
you both.
finished, Secretary of State?
Let me ask you both, if that's all right. Mr. Secretary, Senator Johnson has suggested that you and the administration may be overreacting. He said, we don't shut down our economy because tens of thousands of people die on the highways. We don't shut down our economies because tens of thousands of people die from the common flu. At worst, 3.4% of Americans will die from this virus, he said. What do you say to people that have that view? That's 11 million people he's talking about.
Well, I can just say the entire world is agreeing with us because they all have their choice, and everybody's doing the exact same thing. We want to shut it out, and we can do that, and we'll see what happens in 2 weeks and 3 weeks. But if we can save thousands of lives, and even millions of lives potentially, you don't know where it goes, but you could be talking about millions of lives. So if you look at the world, I mean, you have some very smart people in the world, you have some smart leaders in the world, and everybody's doing it the way we're doing it. I think we're doing a better job than hopefully most, if not all. We're doing a very effective job, but we'll know better in 14 or 15 days. But, you know, you're talking about hundreds of thousands, and maybe more than that, numbers of people. And, you know, we can bring our finances back very quickly. We can't bring the people back.
Mr. President, to follow up on that, there are millions of people out there that share that view, that say, I don't really need to shut things down. I don't really need to stay away from stores. I can go to the beach. And those people making multiple actions exponentially, it's the difference between life and death.
Yeah, I agree with that. But I think I'd like to have Anthony answer that, because to be honest, that's what he does. And we had a lot of very talented people telling us what they think we should do.
Thank you, Mr. President. First of all, I think that's a false equivalency to compare traffic accidents with. I mean, that's totally way out. That's really a false equivalency. When you have something that is new and it's emerging, and you really can't predict totally the impact it's going to have, and you take a look at what's going on in China, and you see what's going on right now in Italy, and what's happening in New York City, I don't think with any moral conscience you could say, why don't we just let it rip and happen and let X% of the people die? I don't understand that reasoning at all.
Okay, so Secretary of State will be leaving. Any other question? Go ahead in the back, please. In the back for Mike.
Thank you, Mr. President.
Excuse me, I didn't call on you. Go ahead, please.
Thank you, Mr. President. Two things. In New York, where cases are doubling every day, they fear that supplies are going to run out in a matter of weeks. Yesterday, Mayor Bill de Blasio called on you to mobilize the military to deliver urgent supplies. Yesterday, he said, quote, the fate of New York City rests in the hands of one man. He is a New Yorker, and right now he is betraying the city he comes from. I've personally spoken to emergency department nurses who say that they've been told not to wear N95 masks because supplies are so low. So how do you respond to those remarks by Mayor de Blasio?
Well, I just think this.
And doctors looking to you, when will those supplies arrive?
I'm not dealing with him. I'm dealing with the governor, and the governor agrees with me, and I agree with him. So far, we've been very much in sync. I guess they're not agreeing with each other necessarily, but the relationship with New York, I love New York. I grew up in New York, as you probably have heard, and the relationship's been very good. And I think government and the governor have been getting along incredibly well with the federal government. Okay.
Question for Secretary Wolf, if I could. Just on illegal entries of people who are OTM, how will the turnback process work? Will they be taken to a common area and then put on a plane and sent back to northern tribe countries or others? I mean, how would that process work?
Again, it's a public health crisis. So what we're trying to do is limit the amount of contact that we have with these individuals, not putting them in Border Patrol facilities, ICE detention facilities, and the like. So it's going to be very rapid. We're going to obviously take them into custody and then send them back to a port of entry or other means. So it'll be very quickly. It won't be the 6 or 7 or 10 days that we currently have. It'll be much more rapid.
But if they are OTM, will they be taken to an airfield
That's
nearby?
correct.
Or?
That's correct.
And sent back home?
Absolutely.
Anybody?
Mr. President, Mr. President, can we ask
Mr. President,
the checks to Americans, the bill as proposed creates sort of tiers of checks for income. Do you believe philosophically that makes sense?
Well, I believe in a lot of things. I want to get workers' money, and whichever way, the best way to get it. And I want to keep the businesses open, too, because without the businesses, they're not going to be getting money for very long. But we're going to be talking.
As it's written, is there enough, or do you want to see it juiced up?
If there's not, we'll do something later, I'm sure. I'm sure we'll do
Mr. President, the Wall Street analysts are predicting that unemployment numbers could skyrocket next week. By some analysts, say as many as 3 million people applying for unemployment, which would be a historic number in a one-week spread. So is a $1,000 check going to cut it? Is that going to be
We're
enough?
not talking about a $1,000 check. We're talking about much more than that. We're also talking about doing phases. If this doesn't work, we're going to keep doing until we get it going. And frankly, once we get the economy back, and once this enemy is defeated, the invisible enemy, as I call it, once it's defeated, we get the economy back, it's going to all come back to us very quickly. It comes back very quickly. We have a tremendous economy. We do numbers like no other country has ever done before. #1 in the world, if you go back 2 weeks, and still, obviously, but if you go back 2 weeks, #1 in the world by far. That money comes back to us very rapidly. We want to keep it, we want to have it so that when we, not if, but when we win the war with the invisible enemy, when we win it, these companies can immediately start, not that they have to start rebuilding, which takes a long time. Steve?
But you're confident that those are jobs that'll come back if someone applies for unemployment next week?
What projections for job losses in March and April are you hearing?
Well, we're looking at different numbers. We have a best case and a not best case, but the big thing is to defeat the virus. Once that virus is defeated, Steve, I think everything else falls in place very rapidly. I think you're going to have a tremendous upswing. A lot of people agree with me. If you look at your stock market geniuses, and some of whom are not geniuses, but they think they are, a lot of people think that I'm right about that, that once we defeat the virus, I think you're going to have a very steep, like a rocket ship, it's going to go up, and everything will be back. And I really believe we're going to be stronger than ever before. Yeah, go ahead.
Mr. President, on the issue of supplies, you've told governors to try to find whatever supplies they can on their own.
Absolutely.
But some of them are now saying when they go to try to buy them, they're being outbid by the federal government.
Well, you heard my news conference yesterday. So that was sort of yesterday's news. No, that does happen because they want to buy supplies. We want to buy as a backup to them in case they can, and sometimes that will happen. But regardless of who gets them, when they need them, we're getting them to them. Now, we're doing the Production Act. We're doing it very much, and we have a lot of things cooking right now at a high level. Remember this. Nothing like this has ever happened before. Over 140 countries. And you have supply chains that are broken down for 2 reasons, because they can't supply that much and because people are sick and they can't be on the chain. So you have a lot of interesting things all over the world. You have supply chains that broke down because of the illness and also because of the quantity. But we're getting it ordered, we're getting it done, and if you just have to, look, some of you were at the call yesterday where I spoke with the governors, almost all of the governors, and every one of them was very impressed with what we've done. Go ahead, in the middle, please.
Mr. President, there are reports saying that the Labor Department has told states not to disclose their unemployment numbers. Do you agree with that decision?
I'd have to talk to him. I would have to talk to him.
Just one more clarifying question, if I could, on the DPA. I just want to be clear. Are you saying that the administration is requiring these industries to create these products, or just asking?
You know, so far we haven't had to. It's an amazing thing that happened. We're getting calls from automobile companies. We're getting calls from other companies saying they have plant capacity. They want to make ventilators. They want to make other things. We are literally being besieged in a beautiful way by companies that want to do the work. They want to do the job. They want to help us. They want to help our country. So we haven't had a problem with that at all.
President, how do you help out states and localities that are trying to bid on things like ventilators and other items that are being outbid by the
Well, when they call us, they let us know. If there's a conflict, they will call us and we will drop our bid because we want them to go first because their point of sale. So we've had 4 or 5 instances where literally that was happening because, you know, we're both trying to get stock. And if we're going against, they will call us. The smart ones, frankly, will call us, and we will immediately, we want them to buy it because it gets to them quicker if they buy it.
Do they know that they're
We're
going to
really
do
there.
this?
They know that, and it's happening more and more where they're calling and they're saying we're bidding against each other. They want to get it. They'll get it much quicker that way. Go ahead, please.
Mr. President, a question for Secretary Azar. There are labs across the country that don't have the testing supplies they need. What specific actions is the administration taking?
I tell you what.
What specific actions
We inherited
are
an
being
obsolete
taken?
deal, and we made a good thing out of it. I haven't heard that question in a while, but go ahead.
Yeah,
Why don't you?
so first, we're making tremendous progress in terms of lab testing. Tens of thousands of tests are being done every single day, both through the CDC and the public health labs, as well as now through the private sector commercial labs. They're getting to scale. They have supplies. They have high throughput. We do hear anecdotally, occasionally, of, say, a public health lab or another one that has a concern about this supply or that supply. Through FEMA, we actually are standing up a laboratory task force to answer those questions. Usually it's that the lab people do not understand that there are actually alternative supplies in the marketplace that they are perfectly free to use. We've actually had to put out some common myths and truths about that. For instance, the other day, we were getting calls from governors saying, we don't have swabs, there are no swabs, there are no swabs. Our supply people went in the open marketplace and bought 200,000 swabs in the open market, and I just sent a letter to every governor sending them swabs. So some of it's just they aren't listening or checking with us about all the freedom, all the capacities out there. It's a complex system with 330 million Americans and all of these labs. So sometimes there's a lab that doesn't understand how much flexibility they have and how much supply there is out there. And we're working through the new FEMA Integration Center to help correct that for folks.
Secretary Azar.
Be happy to. How well that's working.
Well, as I said, more and more tests are being performed every day. And as we learn about the results that are being reported around the country of coronavirus tests, our experts continue to look at the numbers and see that some 90% of Americans that are tested do not test positive for the coronavirus. And so it can give you a sense of the magnitude of testing that's going on. We have the number of cases that we've reported today, but it's in some cases near to 10 times that have been tested. But let me also emphasize how important it was in answering these questions for governors and local officials that the President stood up FEMA and the National Response Center, where we briefed governors yesterday. Now, every governor and their state health departments have the ability to reach out to our regional FEMA administrators. And that's how, as the President said, we're sorting out those potential conflicts between very significant federal purchases and procurements and as hospitals and state governments are purchasing as well. I think the new streamlined system operating now in all 50 states and our territories of governors and states going through their regional administrator for FEMA is going to make it more possible for us to ensure that our hospitals, our healthcare providers have access to what's available on the open market and elsewhere.
Mr. Vice President, you're the head of the task force. You've seen the numbers. You've spoken to average Americans. You're a former governor. What do you say to Americans right now who are watching and who are scared?
I would say, do not be afraid, be vigilant. All the experts tell us that the risk of serious illness to the average American for the coronavirus is low. But we need every American to put into practice the President's coronavirus guidelines, 15 days to slow the spread, because the coronavirus is about 3 times more contagious than the flu, according to our best estimate. And you can contract the coronavirus, have very mild symptoms, if any, not even be aware that you have it, and expose someone who is vulnerable to a very serious health outcome. That's the reason why we're encouraging people to avoid groups of more than 10, to not eat in restaurants, but to use drive-throughs, to wash their hands on a regular basis. And particularly, we're going to continue, as the President has directed us, to focus on the most vulnerable population, which are seniors with serious underlying health conditions or anyone with an underlying immunodeficiency. It's those people we need to care for, but it's going to take all of us working together to make sure they're safe.
Mr. Vice President, on the issue of ventilators, Mr. Vice President.
Because you just said that you haven't had to require companies to up their production of medical supplies. But you said last night you invoked the DPA. I'm confused.
When we need
Require them
something, because of the act, when we need something, we order something. And as you know, 2 days ago, I invoked the act, which was a big step. I'm not sure that it had been done before, certainly not very much. And when we need something, we will use the act. What has happened is, before we even go out, many, many companies, great companies in a totally different business are willing to do things and make things, because that's what they do. They make product. They're willing to make product for us, medical product, that we need very badly for the states, that the states can't get, they haven't been able to get. And you know, most of the states, in no way did they do anything wrong. They were stocked up. They were all equipped. Unfortunately, they've never had a thing like this. So they need help from the federal government.
This is important. You haven't actually directed any companies to start making more ventilators or masks, right?
I have, yes, I have. A lot. And they're making a lot of ventilators, and they're making a lot of masks. Go ahead, please. Go ahead.
Mr. President,
Yes.
partially following up on that, are there automakers right now who are retooling their production facilities to make ventilators or
I can't say they
masks?
are, but they will be very shortly, because we're working with one in particular that wants to make ventilators. They called us yesterday, and we're working on a transaction. They're going to make ventilators. They say they've done it before, which surprised me, but they can do it very easily.
Secretary Azar, this is partially for you, partially for Secretary Azar. You said yesterday that you had spoken to Carnival Corporation's chairman.
Carnival, yeah.
Yes, and he said that he could donate some
No,
ships.
not donate. That's not the word donate.
Okay,
He didn't-
lend.
He's not giving them. He's going to let you use them.
Okay.
I spoke with Mickey
Lend.
Harrison, who's the president, chairman, CEO, and owner.
And he
got
could
every
lend
title
some
he can
ships
have.
to potentially
He
be
said
hospitals.
he said to me that he was willing to, if we need ships for helping people, that Carnival would be absolutely willing to help us in Los Angeles, in New York, wherever they may be, in Miami, where they're very big. If we needed something, they would be willing to. So far, we haven't needed to, and we're bringing the big hospital ships up in California. We're working with the governor of California, as you know, with Gavin, and we haven't made a determination. We're also talking to folks who would like it in Seattle, so we're discussing where it can be most useful. We've spoken with Governor Cuomo, and we're bringing the big hospital ship up in 2 weeks, and we're going to have it in New York Harbor, someplace in New York Harbor.
So my question is, one, it sounds like you haven't taken them up on it yet, but
No, I have taken
you
them up.
could.
I said if we need it, I'll let you know.
Okay.
That's called taking them up.
And secondly,
Right now, we don't need
cruise
it.
ships have a lot of frequently contacted surfaces, and so this is where you come in, Secretary Azar, potentially Dr. Fauci. Do you have concerns about the cruise ships being used as hospitals?
Well, I can tell you they're very clean, and also those surfaces, the germ, as you know, the virus, disappears over a period of time. And these ships are very clean. They've been kept very clean. They've been gone over, but the virus, as you know, if it's on a surface for a certain, they have actually charts, different kinds of surfaces, it disappears over a period of
Why not
time.
just choose hotels?
What are you trying to get at? Go ahead.
Well, that's what I'm asking. Why not
It
just choose hotels?
disappears, the virus disappears when it's on surface after a certain number of days, or in some cases hours, depending on the surface it's in. Go ahead, please.
Thank you. A quick follow-up. So can you name any of the companies that you've asked to start making these ventilators or face masks?
I will be, but first I want to get the approval from the company, because I don't want to be doing that.
Okay, well,
I assume they'd like it, but I'll let you know.
Okay, well, thank you. And this is for Dr. Fauci.
One company that has openly stated it is General Motors.
So that's one of the, did
One of
the
companies,
government
but
ask
I
General
didn't.
Motors to
I
do
didn't
that?
speak to them about announcing it, but I'll announce it. I'm sure they wouldn't be, but we have others also.
Thank you.
Okay.
And so for Dr. Fauci, there's new research out that the CDC has released that many of the people that 13% of the people with the coronavirus got it from someone that was asymptomatic. So my question is, does that change the way the approach that should be taken? And do you think that's the case, or do you think that, or do you not agree with that research?
The recommendations that are here applies to whether you're in physical contact with someone who could be infected with symptoms versus asymptomatic. I don't really think it changes anything. Certainly, there is some degree of asymptomatic transmissibility. It's still not quite clear exactly what that is. But when people focus on that, I think they take their eye off the real ball, which is the things you do will mitigate against getting infected, no matter whether you're near someone who is asymptomatic or not. It's the same thing. Physical separation and the care that's outlined here is going to take care of both of those things.
Thank you, Mr. President. I have a question about testing. When will every American who needs a test get a test and be able to get a test? And why not have medical equipment being shipped right now to hospitals who need it?
You're hearing very positive things about testing, and just so you understand, we don't want every American to go out and get a test. 350 million people. We don't want that. We want people that are that have a problem, that have a problem with they're sneezing, they're sniffling, they don't feel good, they have a temperature. There are a lot of different things. You know them better than I do. So ready? We don't need that. But what we are having is we're having these private labs have come in. They've been really fantastic. And we also have a great system for the future. Because as I said, we inherited, meaning this administration, an obsolete, broken system that wasn't meant for anything like this. Now we have a system that you can see, because look, we're well into this and nobody's even talking about it except for you, which doesn't surprise me.
There are Americans, though, who say that they have symptoms and they can't get tests.
Well, okay.
What do you say to the Americans who are scared that they have symptoms and they can't get
But we don't
tests?
want everybody to go out and get a test, because there's no reason for it. Yeah.
Americans who have symptoms.
We'll do
and
one
can't get
more
a
after
test.
this.
Dr. Fauci, because Kevin Hassett is one of the people who is now suggesting that the real way to get to the end of this, for life to return to normal, is for every single person living in this country to be tested. That way you could see who's contagious, and you could then have people who don't have it go back to work. Is there any possibility that this country could ever get to a point where every single person could be tested, and how long would that take?
Thank you for the question. I've heard that before. I don't connect the dots there. I don't see how testing everybody in the country is going to help you to implement this. This should be implemented universally, at least at this level for everyone. The things we spoke about a while ago, that you want to really ratchet it up, like Governor Newsom is doing in California, like Governor Cuomo is doing in New York, or how you put an end to this outbreak. Testing is important. It would be nice to know, and there are certain things you could do, but let's not conflate testing with the action that we have to take. Whether or not you test, do this. I'm not putting down testing as an important issue, but people seem to link them so much that if you don't have universal testing, you can't respond to the outbreak. You really can.
But I do think, and that's after listening to Tony and everybody else that's an expert, I do think it's important that not everybody be tested. If you feel great and if you have no symptoms whatsoever, it's just not a good thing to be doing. All right, Steve?
A question for Dr. Fauci. Yesterday you mentioned the possibility of aerosol transmission of the virus. How likely is that to happen?
I mean, the possibility of aerosol transmission always comes up when you have situations like that. It comes up with influenza. It came up with SARS, in which there was a documented, one-off episode of some aerosol transmission. Aerosol means that it can stay in the air for a period of time because it's in a droplet that's very small and doesn't go down. Is it possible that there is aerosol transmission? Yeah, it certainly is. But clearly, what we have seen in the situations where people have gotten infected from the areas that we have experienced, China, South Korea, now Europe, most of it is in a situation where people are close enough to each other that a symptomatic person will have a real droplet transmission. So I'm not ruling out the possibility that it's aerosol. But again, it's not going to substantially change doing this.
Dr. Fauci, quick follow-up on the testing issue. Let me just ask this in a very simple way. What is the demand pressure on testing in this country, and are we meeting it?
I get the same calls that many of you get, that someone goes into a place who has a symptom and wants to get a test, and for one reason or other, multiple, logistic, technical, what have you, they can't get it. That is a reality that is happening now. Is it the same as it was a few weeks ago? Absolutely not, because as the Secretary and others have said, right now that we have the private sector involved, the availability, not only just availability, but the implementation of the availability is getting better and better and better. Having said that, I understand and empathize with the people who rightfully are saying, I'm trying to get a test and I can't.
So is that a way of saying we are not yet at a point where we are meeting the demand pressure?
Well, the answer is yes, John. We are not there yet, because otherwise people would be never calling up saying they can't get a test.
Mr. President?
Well, I just can't emphasize enough about the incredible progress that we have made on testing. All of you are reporting, and media outlets around the country are as well, that many, many more tests are being performed every day, literally by the tens of thousands. And this has only been made possible because several weeks ago the President brought in the commercial labs, these enormous companies, Quest and LabCorp, working with companies like Roche and Abbott Laboratories and Thermo Fisher, and said, we have this existing system of state laboratories and the CDC processing tests for certain infections. But given the magnitude of this outbreak, the President apprehended early on that it wouldn't be enough to meet the need. And I just want every American to know that literally hour by hour, in partnership with these extraordinary commercial labs, we are making more and more tests available every day. We'll detail the way that we're working with states to distribute those tests. We've obviously focused on states that have been dealing with the most serious outbreaks of coronavirus: Washington State, California, New York, and others. We've been making sure the tests are in those areas, working closely with those governors. But I think the American people should be encouraged at the progress that we are making. Tomorrow we'll take some time to detail that progress for you, but I would say to any American who might be concerned that they have symptoms, as the President said so well, we don't want every healthy American to get a test. But if people feel that they have symptoms that they identify with the coronavirus, call your doctor. Their doctor can call their state health authorities that can work very closely with our entire team through HHS and FEMA and work to identify the more and more tests that are available every day.
Just so you know, just for the probably 100th time, this administration, inherited an obsolete, broken, old system that wasn't meant for this. We discarded that system, and we now have a new system that can do millions of people as you need them. But we had to get rid of a broken old system that didn't work. It worked only on a very limited basis. And we're very proud of what we've done. It's incredible what we've done. And this system will now serve for the future, for future problems. Hopefully you don't have a problem like this, but something will come up. We have now a great system, and it's almost fully in gear, but it's able to test millions of people. But we inherited a broken, old, frankly, a terrible system. We fixed it, and we've done a great job. And we haven't been given the credit that we deserve, that I can tell you. But the one that really deserves the credit are the American people, because they are doing things that nobody thought they would do. What they're doing is incredible, and we're making a lot of progress, and we'll see you folks tomorrow. Thank you very much.